Assalamualaikum everyone. Welcome back to the channel FLOSS. We were doing our removable partial dentures in which we were doing our maxillary major connectors. So moving on. Okay, we covered till our four types of major connectors. Okay, in which in previous lectures, in which we studied single palatal strap, combination anterior posterior palatal strap type of connector, palatal plate type of connector, and U-shaped palatal connector. In this lecture, we will covering our single palatal bar. Okay, which is this one. This is your single palatal bar. So moving on, single palatal bar. A palatal connector component that is less than 8 mm in its width is referred to as a bar. Okay, a connector, this is your major single palatal connector. Okay, and its width from this point to this point is less than 8 mm. Then this type of a connector is referred to as a bar. This distinction is crucial in understanding the functional and mechanical implication. A palatal bar is a connector that is less than 8 mm in width and requires concentrated bulk to maintain its rigidity. Its width is less than 8 mm, but it's thick. It is concentrated in bulk. It's thick and to maintain the rigidity of the connector or the denture. On the other hand, a palatal strap is broader than 8 mm, okay, and distributes stress more efficiently across the plate. While a single palatal bar is widely used, it is often not the best choice due to patient comfort issues. Single palatal bar is used widely, but it is not the best choice. Okay, the difference between a single palatal bar and a palatal plate strap. See, this is a strap. This length, the width from this point to this point of a strap is more than 8 mm. But when this length is decreased than 8 mm, the bar is referred to as that type of a strap is then referred to as a bar. Okay, and this one is more you may say preferable type of a connector, and this one is less preferable type, but most widely used one is palatal bar type. What are the issues with a single palatal bar? That for a palatal bar to be effective, it must ensure rigidity to provide proper support and cross arch stabilization and be centrally positioned between the halves of the denture. Okay, and secondly, what are the problematic issues with this kind of a denture? It is that it may be too thin and flexible, resulting in inadequate support. It may be too bulky, leading to discomfort and interference with the patient tongues. It alters the natural palatal contours, making it objectionable to the patients. Three problems with single palatal bar are that if it's too thin, then it will be more flexible, which will be resulting in inadequate support. And if it's too bulky, it will lead to discomfort. If it's used for a longer period of time, it will alter the natural palatal contours. Okay, and what are the issues with this? To ensure rigidity and provide support, the to provide proper support and cross arch stabilization, and for rigidity we need to give more bulk, and when it get too bulky, it leads to discomfort. And second issue is that it should be centrally positioned between the halves of the denture. Okay, when to use, what are the indication of a single palatal bar? That the decision to use a single palatal bar should be based on the size of the denture bearing areas, uh, and whether a single connector can be rigid enough without excessive bulk or not. These two conditions are those on which a decision is made to whether to give a palatal bar or not. If these conditions are not met, a palatal strap is preferred for a better stress distribution and improved patient comfort. Okay? Okay. So I hope everything is clear till here in regarding this single palatal bar. If not, kindly comment it down and I will address those questions. Okay. Design of maxillary major connector. There are 5 steps in designing a maxillary major connector. The first one is that you need to outline the primary denture bearing areas where you need to place your missing teeth, okay, or the phantom teeth. There are 3 areas that will be covered. These are the areas that will be covered by the denture base. Second is to outline the non-denture bearing areas where you are not going to give your denture. Areas that should not support the denture include lingual gingival tissues within 5 to 6 mm of the remaining teeth, hard areas of the median palatal raphe including a tori, palatal tissue posterior to the vibrating line. These 3 areas are those where you're not going to place your denture. Okay, they are non-bearing areas. Which 3 are these? Lingual gingival tissues, hard areas on the median palatal raphe, and palatal tissues posterior to the vibrating line. The step 3 is you outline the connector areas. Once step 1 and step 2 are completed, the remaining areas are available for connector placement. Okay. Step 4 is the selection of connector type, what kind of a connector you are going to give. Okay, factors to consider when selecting a connector is that mouth comfort to avoid interferences with the tongue function. Second, rigidity. Most must distribute stress effectively. Location of the denture base, contour, connector choice depend on edentulous areas. Indirect retention must accommodate indirect retainers if needed. Double strap connectors provide maximum rigidity with minimal bulk. If edentulous area are anterior or posterior, strap alone is not ideal. If edentulous areas are posterior, then an anterior strap alone is not ideal. Okay, in this step 4, you are selecting your what type of connector you are going to give. So these are the 7 points that you need to keep in mind while selecting a type of a connector. One is that mouth comfort. Which kind of a connector provide greatest amount of mouth comfort? Uh, okay. The second one is rigidity. Which one is most rigid and distributes stress effectively? Second is that which areas you are giving your denture base. Okay, what are the areas that are edentulous? So then you can that also needs to be considered while selecting a connector type. Fourth is your indirect retention. So the connector that you're giving, it must accommodate indirect retainers if needed. Double strap connector provides maximum rigidity. We should go for double straps, which can be anterior and posteriorly placed both, okay, to give maximum rigidity with minimal bulk. Okay. Then, if the edentulous areas are anterior, then a posterior strap alone is not ideal. Okay, then you have to give an anterior strap as well along with the posterior one. And if the edentulous areas are posterior, then only an anterior strap is not ideal. Then you have to give an posterior strap with an anterior strap to cover those posterior edentulous areas. Then fifth step is your unification. Then you have to join all the connectors with denture base areas to ensure the stability. Or then you have in this step you need to join out all the different components of the denture to give maximum stability. In the next picture, in this one, we are like explaining all the 5 steps. Once you in this you have to cover. First step was your to outline the denture bearing areas, which are this and this. See in picture B, we have covered that. Then you have to outline the non-denture bearing areas. These are your lingual areas, then your tori area, and then your soft tissue area, that is vibrating line area. These 3 areas are your where you're not going to place your denture. Then you have to give a type of a connector. See, this is an anterior strap and this here will be your posterior strap. Okay, so this is the type of connector that you are giving. And fifth one is that you need to connect all these areas together to ensure maximum stability of the denture and for proper function. Okay, I hope all of this is clear. If not, kindly comment it down on the comment it down below in the video, and you can also ask me your queries on my Instagram channel, Do follow me on my Instagram as well, and like, comment, share, and subscribe my video. Thank you so much.